Hi, I'm Leanne Spriggs and I'm a clinical nurse specialist. I've been a nurse with Rennie Grove for almost 2 years, so 2 years this summer. I find the job really rewarding. I absolutely love coming to work every day. I love the children and their families. I really enjoy seeing the impact that the service has on the family and that child, and also the impact that I can have on a day-to-day basis. Being an advocate for the child, providing nursing care, advice and support. The team's been working with between 50 and 60 families. We have planned contacts, so that could be telephone calls for nursing assessments over the telephone, planned visits for respite sessions, play sessions, nursing assessments, symptom reviews, lots of different types of visits that we offer, as well as telephone support and advice as well. So anything planned will be booked in. But then of course we do have a lot of urgent contacts, that can be visits or telephone calls, urgent meetings with professionals, consultants, other nursing teams. So we, on a day-to-day basis, will manage our priorities. So we work with children from diagnosis, and then that could either be many years, months, or even days or weeks until we aren't working with them anymore. And that can be for many reasons. We have children on the caseload who have a life-limiting or life-threatening diagnosis, but they will live a very healthy, long childhood life. So we could discharge them at the end onto adult services. For other children, they will be on the caseload for a number of years, and we will support them with symptom management as required, and the different services that the hospice offer. Some families come onto the caseload and it will be a very short time that we are with them, so we have to build those relationships very quickly, build that trust. It's really important to build a really good relationship with the families. So during the first visit, it's really to get to know the families, to get to know where they're at with the child's condition, where the child and their siblings, where they're at, how the family are feeling, and try to get a feel for what the family need, what support can be offered, and where the family see us supporting them. We are advocates for the child and family. Within nursing generally, you have to act as an advocate for your patients to ensure that they're getting the best quality care. So if we are providing nursing care for a child or nursing advice, symptom management, we will always act as an advocate for them to ensure that they are getting the care that they're needing at the time. We'll liaise with the consultants and the wider multidisciplinary team, so the other healthcare professionals involved, to ensure that we are all doing what we need to be doing at the time for the child. A lot of what we do during our working hours, we try to empower the parents so that they can manage lots of different situations out of hours at the weekends, etc. That could mean administering medications, changing feeding tubes, lots of nursing things that actually parents can be taught at home. We will try and support with that during the daytime. And then out of hours, we will receive calls to support with these things, but often we're able to talk them through it over the phone. They can remember what they've been taught, we can discuss that, and usually we can manage things in that way. Sometimes it's not that simple, and we do go out to support parents with different things. Other times the calls that we receive out of hours are to offer symptom management, so a parent will call up and discuss a symptom with us. We will give a plan and advise that they call back within the next hour or so if the plan has been carried out, but actually we haven't gotten anywhere. Then we will go out and see the child, and we will do a normal assessment visit any time of day or night if required. We adapt the service, adapt what you need as things progress or as things deteriorate. We'll always be here for you. You know, everything you need, we will sort out. As a hospice, we offer holistic care, so that includes the nursing care, but also other services as well. So we have family support, complementary therapies, supporting hands, play, respite, lots of different services to support the children and their families. So if the child has a palliative diagnosis or a diagnosis that is life-limiting or life-threatening, they may not be needing nursing care all of that time, but the families may need some support. There are lots of decisions to be made, lots of difficult conversations, and it may be that families need support around that. Maybe they need a break, they just need some time out for themselves, so we can support with that. And as well the play, to make sure that siblings and children are enjoying that time together, so it's not always just the nursing care. We have a very new play specialist in our team. She's been with us a few months now, and she has had a massive impact on the service already. The children and families absolutely love her. It's really important, I think, as a hospice at home team, that we prioritise the positive moments, making moments matter, really enhancing the children's quality of life, and that's absolutely what we've been able to do with the play specialist role. I think it really varies between the families which part of the service has the biggest impact. For some, it could be the respite and short breaks. That could be really important to them if their child maybe is more stable with regards to symptom management, or if they're very complex, then actually it really gives the family a break or some time to do other things with siblings or mum and dad together. For other families, it's the nursing advice and the guidance that is really important, that we can be there 24/7 if required, weekends, in the evenings, to offer that support. And then for other children and families, maybe they're newly diagnosed or maybe their nursing needs are quite low at the moment, it would be play that is really important. Maybe they've lost skills, adapting to new ways of playing, and that time spent with them is really important. Children are incredibly brave and so strong. They deal with everything that is thrown at them so well, and they really try to protect their families as well. You can see that they are protecting their parents, protecting their siblings, despite what they're going through themselves. Good days, bad days, they'll always be smiling, always be happy, really making the most of everything. So children do have questions about their diagnosis, prognosis, etc., and what's going on with them. We always encourage parents and professionals to be honest with children. If you want to build trust with a child, they need to know that they can trust you and that you will tell the truth. So we will be honest as much as we can with the children. We appreciate that there are some things that the families want to speak about together or may not want to speak about in front of the children. So we will always check with the parents, but we will always try to reassure the children that they have a loving family around them, they have all the support they need. So if they have any questions or any problems, always tell somebody. End of life is very different for every family, and it can be a process that can take months, where a child deteriorates very slowly, which can be really tough on the families to watch and tough for the child and their family and friends. For other children, it can be a matter of weeks, so they may have been quite stable and quite well and then had a sudden deterioration, and then things happen quite quickly. And then there are other situations that we'll know that the child has days. So we will be there for that family, supporting as they need at home with all of their nursing care, and that would be 24 hours a day at the end of life. We will support as many times as needed during the day and night for a child at end of life, managing their symptoms, managing parents' anxieties, managing all of their nursing needs, so how they're feeding, if they have oxygen, any of the tubes, the medications, all of those things will be there to empower the family to be able to do that, but also support them so that parents can be parents. When the child gets to end of life, we will also be there for the family. So some families will want just the family there at that time. It may be a very settled death, which is always better, and the family will feel that actually they don't need any nurses there, they just want to be with the child, with their close family, and they'll know that we're at the end of the phone. We'll come out as soon as they need us, if they need us. Some deaths aren't so settled, and the family may need us there throughout, which we will be. We can be there for many hours if required, so that the family know that they will always have the support from us. After death as well, we'll also continue to support the family. Some families will want to keep their child at home. They may want to say some goodbyes. They may want other family members to come and spend some time with the child after they've died. And we have the facilities to be able to keep the child at home. So we will do that for the family, and we'll go out and see them and make sure that everything they need is sorted. There's hope until the end. So, and we have to work alongside that hope, remaining hopeful for the child and family, but also appreciating what is ahead of us, and making sure that we get everything in place so that if anything happens or when things happen, it's not stressful for the family. It's very easy. They almost don't notice the transition into end of life, and it's still the same faces, we're still the same people, we still care, we're still doing everything that we were doing, all of the nice fun things, but also adapting to the current need.